Wendy, I'm so glad we're having this conversation, especially in Mental Health Month, and just recently discovered that the CDC estimates 1 in 5 children have a diagnosable mental health disorder. How did that factor into your founding of Futures Thrive?
It's such a great point, actually. In fact, the 1 in 5 statistic is decades old. And so I know the pandemic really highlighted a lot for a lot of people, but the 1 in 5 number hasn't changed regardless of the millions and even billions of dollars of awareness campaigns that we've done societally. So for me, it really resonated with me because I'm a parent that had a child with an undiagnosed mental health condition. And that thrust me into figuring out, why are we okay with these statistics not changing?
Well, you have just developed such an ingenious approach for screening purposes by using video game technology, which children are so familiar with. Tell me a little bit about your unique approach.
Just like we do for every other health condition, I felt it was really important for 2 main reasons to start screening early and before there's a problem, right? So that gives you 2 opportunities. One is to create baselines for kids. So what is this child authentically like before they show signs and symptoms of anxiety or depression or worse, right? But the other, that it gives every parent the opportunity to learn about mental health, and it takes the stigma down so that when signs and symptoms do show up, if they show up, a parent isn't disarmed to say, oh my gosh, what is this? This is terrible. They can really say, oh, my child's always run a little bit worried, or my child's always run a little bit anxious. Now we're in the middle of an international pandemic and we can see this spike. The spike makes sense. Let's get them help. So that's kind of the early piece of it. And what I believe we should be doing for mental health is what we do for every other health condition. We certainly wouldn't treat childhood cancer at stage 4. Yet that's how we're looking at it right now for mental health. The game end of it, I don't know about you, but I'm raising a 14-year-old and 15-year-old girls. So if you ask them how their day is, you get fine, or maybe fine, but you really don't get a lot of information. So just taking a dive into, how would kids really report? How can we get them giving us more information? How can we learn? Well, as you said it, a 21st century kid is comfortable playing a game.
Let's say a child is 11 or 12. If they're asked a question by their pediatrician, I feel like they would know the right answer to the question. And yet, if they are doing, if they're engaged with your video technology, I would guess that you get maybe a little bit more authentic findings than if you do that, fill in the bubble circle kind of thing.
I'm so glad you said that, because again, if you talk to, so screening tools have not been evaluated since the 1980s. Now, I'm a child of the 80s. I love the 80s, but we are not raising children of the 80s. We've got to start to screen them the way they understand it. And 21st century kids know exactly what the parents want them to say. As again, all these awareness campaigns, kids are very aware. They have millions and millions of information sources at their fingertips in their pocket. So they know what they want to say. So then we've got that juxtapose of, right, we want to do the screening, but how do we get the information? We have found that engaging, at least for children, in a world that is outside of their own, really gets us the information. And scientifically, that 11, 12 really wants to tell you how they feel. It's called tween. It's not quite a teen. When they get to 13, it's a totally different story. But that early, right before they're a teenager period of time, they're just innocent enough to tell you everything. And we know, half of all lifetime cases show signs and symptoms before the age of 14. So we really can capitalize on early intervention if we start asking the questions.
So how can parents or pediatricians, how can they learn more about Futures Thrive? How can they explore what it is that you've developed?
So on our website, www.futuresTHRIVE.com, they can take the survey questions. It's anonymous. We don't ask who they are, because they're just helping us inform the question viability. We are in the middle of a National Science Foundation grant, which we've been awarded, where we have to interview 30 pediatricians. So we're in the middle of interviewing those. If pediatrician wanted to reach out, they could just email me. The interviews take 30 minutes. They're not a sales pitch. We don't talk about ourselves at all. In fact, we just really lean into the expertise of the doctor, which has been really fun and very enlightening.
Well, I just can't think that you aren't going to have success with this, and to be that far along and just on the cusp of having some screening incorporated into the normal pattern of childcare, that's really exciting. Thank you so much for what you've done on that.
Thank you.